Welcome to Anatomy Head and Neck videos series. Today we will talk about temporal mandibular joint, TMJ. Temporal mandibular joint is a joint that is linking the skull with the lower compartment, the lower jaw, which is the mandible. So we will talk in this video about compartments of TMJ, joint capsule, ligaments, vascular supply, and innervation of TMJ. Let's start talking about compartments. TMJ is consisting from two compartments. First compartment is named as superior compartment, which is bordered superiorly by the temporal fossa of temporal bone. Here is the mandibular fossa of the temporal bone, and inferiorly by the articular disc itself. TMJ have articular disc in the middle, which is dividing the disc joint into two compartments. So the superior compartment bordered by the mandibular fossa and the articular disc, and it contains 1.2 mils from the synovial fluid. Inferior compartment is bordered by the articular disc superiorly, and inferior border will be the condyle of mandible. Here we can see the condyle of mandible, and it can contain 0.9 mils of the synovial fluid. Superior compartment is responsible for the transitional movement of joint. Inferior compartment is responsible for the rotational movement of the joint. Capsule of TMJ originates from the border of mandibular fossa, encloses the articular disc, and inserts in the neck of mandible. So this is the capsule. It starts here, the borders of mandibular fossa, enclosing the articular disc in the middle and inserting in the mandibular neck. Okay, the capsule loose, that the mandible can naturally dislocate anteriorly. The capsule is loose somehow, so the mandible can dislocate anteriorly easily. Let's talk about ligaments. We have 4 ligaments. Firstly, the lateral ligament. Lateral ligament is the closest ligament to the TMJ. It is located lateral to the capsule. As we see here, lateral to the capsule, we have the lateral ligament. So also we have the sphenomandibular ligament. Here's the sphenomandibular ligament. It originates from the spine of sphenoid bone. As we can see here, there is a spine of sphenoid bone, and inserted in the medial side of ramus of mandible, mainly in the lingula. We have a structure in the medial side called the lingula. We can see it here. This is the lingula. Sphenomandibular ligament is inserted in this lingula and originates from the spine of sphenoid bone. As we can see, it's located medial to the joint. Third ligament will be the stylomandibular ligament, and it passes from the styloid process, as the name indicates, and inserted in the posterior margin and angle of mandible. Here we can see the origin of this ligament and also the insertion in the posterior border and the angle of mandible. 3 ligaments supports the TMJ. Vascular supply for the TMJ will be 3 arteries. Main supply will be from deep auricular artery, from the maxillary artery, and here we can't see the branch, but we can see the maxillary artery. See how the maxillary artery comes so close to the TMJ? It gives a branch called deep auricular artery that supplies the TMJ mainly. We have also superficial temporal artery. We can see it here. Superficial temporal artery. Look how close it's to TMJ. Also, it gives blood supply to the TMJ, and also the anterior tympanic artery, which is a branch from maxillary artery. So arterial supply to TMJ mainly from deep auricular artery, a branch from maxillary artery, also from anterior tympanic artery, which is also a branch from the maxillary artery, and the superficial temporal artery, and its branch from external carotid artery. Okay, it's a terminal branch. Okay. If we talk about the venous, blood drains into the superficial temporal vein and the maxillary vein. As the arterial supply, there is the venous drainage. We can see the maxillary to see how it's close to TMJ. Maxillary vein. Here's the maxillary vein. See it how it's close to the TMJ, and also the superficial temporal vein. Here's it. Look. So as the arterial, there is the venous from maxillary vein and the superficial temporal vein. Innervation will be mainly from the mandibular nerve, and we have additional innervation from the mesenteric nerve and deep temporal nerve, which is the branches of mandibular nerve. If we want to see it closely here, mandibular nerve. Okay, here's the mandibular nerve. See how it's very close to the TMJ. So it innervates the TMJ mainly with its two branches, deep temporal nerves and the mesenteric nerves. So here we can see the arterial supply again from the maxillary nerve. We can take two branches, deep auricular artery and the anterior tympanic artery. From the superficial temporal artery also there is the blood supply, drainage made by the maxillary vein and the superficial temporal vein, and the innervation will be mainly from the mandibular nerve and its branches, mesenteric nerve and the deep temporal nerve. This is all about TMJ. See you in the next video. Bye bye.